This demonstration is about prolactinoma, which is a condition of high levels of prolactin in blood. Prolactin is a hormone produced and released by the anterior pituitary gland, which is mainly associated with the production of milk after childbirth. Pituitary gland is a pea-sized gland located at the base of the brain. As you see, it lies below hypothalamus and receives both inhibitory and stimulatory inputs from the hypothalamus. Pituitary gland in humans sits in a protective bony enclosure called the sella turcica. It is composed of two lobes, anterior and posterior, with intermediate lobe that joins the two regions. The hypothalamus and the pituitary gland are connected by a structure called the infundibulum, which contains vasculature and nerve axons. Pituitary gland is an endocrine gland composed primarily of 5 hormone-producing cell types: thyrotropes, lectotropes, corticotropes, somatotropes, and gonadotropes. Lectotropes are the cells which are involved in prolactin secretion. Lectotropes are the cells in the anterior pituitary. They are acidophilic and produce and release prolactin in response to hormone thyrotropin releasing hormone (TRH) that is released from the hypothalamus. Prolactin serves the following functions. It helps in initiation and maintenance of lactation. It induces ductal growth and lobular alveolar system. It takes part in synthesis of milk protein like casein and lactoalbumin. It is important in control of osmolality. It helps in metabolism of subcutaneous fat, carbohydrate, calcium, and vitamin D. It helps fetal lung development, and it takes part in steroidogenesis, which is formation of steroids from the adrenal cortex, testes, and ovaries. Regulation of prolactin is a crucial step and involves 2 controls: inhibitory control, which is by dopamine acting on D2 receptors located on lectotropes. Stimulatory control is by the hypothalamic peptides, thyrotropin-releasing hormone, and vasoactive intestinal peptide. However, prolactin itself inhibits gonadotropin hormones. Thyrotropin-releasing hormone from hypothalamus stimulates pituitary gland to release prolactin, which causes lactation. Factors other than prolactin that cause lactation are estrogen, progesterone, growth hormone, insulin, thyroid hormone, and glucocorticoids. And those factors that inhibit lactation are high levels of estrogen and progesterone. Prolactinoma is a benign tumor of the pituitary gland that produces prolactin. Having too much prolactin in the blood leads to a condition called hyperprolectinemia. Most pituitary tumors develop on their own. The cause of these tumors is unknown. In some cases, genetic factors may play a role. Prolactin levels normally rise during pregnancy and breastfeeding. They may also rise slightly at other times, such as physiological conditions including exercise, lactation, pregnancy, sleep, physical stress, sexual activity, epileptic seizures, meal, and pathophysiological causes such as pituitary conditions, acromegaly, and Cushing's disease, hypothyroidism, kidney diseases such as renal failure, liver failure, and certain medications that increase prolactin levels, including antipsychotic drugs, anti-dopaminergic drugs, high blood pressure medicines, drugs used to treat nausea and vomiting. If high prolactin levels are because of a medicine, these levels will usually return to normal 3 to 4 days after the drug is stopped. Small benign pituitary tumors are fairly common in the general population. A prolactinoma is the most common type of pituitary tumor, making up about 40% of all pituitary tumors. Women are more likely than men to develop a prolactinoma. These tumors rarely occur in children and adolescents. In children, prolactinomas may prevent the start to block the progression of puberty. Among women, common symptoms of having a prolactinoma include changes in menstruation such as irregular periods or no periods, infertility, milky discharge from the breasts also called galactorrhea, loss of interest in sex, pain or discomfort during sex due to vaginal dryness. Among men, common symptoms include loss of interest in sex, low levels of testosterone, erectile dysfunction, and decreased body and facial hair. Women often report symptoms earlier than men because they may notice changes in their periods or milky discharge from their breasts when they are not pregnant or breastfeeding, but women who are taking sex hormones and birth control pills or hormone replacement therapy may not experience these changes. The same is true for women who have reached menopause and no longer have periods. Among these women and among men, a lack of clear signs and symptoms may lead to delayed diagnosis. Having a prolactinoma can lead to different complications and problems among women and men. Some of these are caused by having too much prolactin in the body, while others are linked to the size and location of the tumor. Excess prolactin or hyperprolactinemia can lower levels of sex hormones in both gender. Related complications can include infertility and bone loss. Prolactinomas are usually small, less than 1 centimeter in diameter. These small tumors are called Macroprolactinomas. Less commonly, a tumor may grow to more than 1 centimeter in diameter. These larger tumors are called Macroprolactinomas. Macroprolactinomas may press against nearby parts of the pituitary gland and the brain, leading to complications such as visual problems caused when the tumor presses on the optic nerves or optic chiasma, the part of the brain where two optic nerves cross each other. Expansion of a pituitary tumor within the sella turcica stimulates afferent fibers innervating the dura mater. These afferent fibers are known to be pain-producing, thus being the cause of the headache. Prolactinomas can be diagnosed based on the results of two tests, blood test and imaging test. In blood test, we measure the level of prolactin and in some cases the level of thyrotropin-releasing hormone. Imaging tests involve magnetic resonance imaging, which is MRI scan, and computed tomography, which is CT scan. MRI scan uses radio waves and magnets to create detailed images of your internal organs and soft tissues without X-rays. If an MRI is not a good option for you, your doctor may order a computed tomography, which is CT scan. The results of the imaging test usually will allow your doctor to confirm a diagnosis of prolactinoma and determine its size and location. Medicines called dopamine agonists control prolactin levels and shrink the tumor very effectively. These drugs mimic the effects of the brain chemical dopamine. Two dopamine agonists are most commonly used to treat prolactinomas: bromocriptine, a drug that must be taken twice or thrice daily; cabergoline, a drug that can be taken once or twice per week. Although doctors most often treat prolactinomas with medicines, in some cases surgery may be an option. Two types of surgery may be used: transsphenoidal surgery and transcranial surgery. Transsphenoidal surgery is most commonly used in prolactinoma. The surgery is done through an incision or cut at the back of the nasal cavity or the underlip. Transcranial surgery is used more rarely if the tumor is larger or has spread to other areas. The surgeon removes the tumor through an opening in the skull. Before pregnancy, having a prolactinoma may make it difficult for you to become pregnant, but treatment with dopamine agonists is very effective in restoring fertility. When pregnancy is confirmed, although studies suggest that both bromocriptine and cabergoline can be safely taken in the early stages of pregnancy, bromocriptine is typically preferred because of its longer safety record. As soon as your pregnancy is confirmed, your doctor will usually advise you to stop taking these medicines to prevent any possible effects on the fetus. During pregnancy, prolactin levels normally increase, preparing your breasts to make milk after your baby is born. The pituitary gland often doubles in size. Your prolactinoma may also grow in size, especially if it is already large. If you begin to have symptoms such as headaches and changes in vision, your doctor may recommend that you start taking the medicine again.